You are watching McLaren Port Huron Today's Health, and I'm speaking with vascular surgeon Dr. Joseph Cuppari about conditions related to stroke and carotid artery disease. So Dr. Cuppari, let's start with what is carotid artery disease?
So carotid artery disease is a plaque buildup or a buildup of plaque within the carotid artery that can cause decreased blood flow to that area or distal areas past that to the brain. These plaques build up with cholesterol and ultimately will cause a decrease in blood flow.
And maybe just for our audience, let's tell them where the carotid artery is.
So carotid artery is in the neck. Our heart pumps into a bigger vessel called the aorta, the arch. Then it will branch into carotid arteries as well as other vessels. But to get blood flow to the brain, there are 4 vessels that go, 2 vertebrals and 2 carotids. Once it gets up into the neck, the carotid will then split into 2, forming an external carotid artery, which basically brings blood flow to the face and the skin. And then you have the internal carotid artery, which takes the blood to the brain.
So who would be at risk for carotid artery disease? So
carotid artery disease, the risk is basically the same as coronary artery disease, any vascular disease. Increased age is always, as we get older, our vessels get harder and we build up more plaque. High cholesterol, tobacco use. Tobacco use is one of my biggest risk factors for carotid artery disease. Basically anything that can damage the vessel and cause an increased plaque. That can be also diabetes as well.
So would a patient really have any symptoms?
No, that's the difficult thing about carotid artery disease is most of the symptoms, if you get a symptom from carotid artery disease, is going to be a stroke, which is sad because you really you're not told, you don't have, like other things, you can have a little bit of pain here or there and then something's wrong. With carotid artery disease, if you have a stroke, it's a stroke. Sometimes you can get a mini stroke, which is called a TIA, if you're lucky, and that's a transient ischemic attack. Where a little piece of plaque will go up and cause some type of dysfunction or decrease blood flow to a certain part of your brain. Sometimes we call that in the eye, you get this blackness that comes down your eye. That's usually the first sign if you're going to have a sign.
And what other symptoms of stroke would people need to be aware of?
So, well, if you have a stroke, so some of the symptoms of stroke are facial droop, also weakness one side or the other, as well as speech issues. So some people won't be able to speak, say a sentence. Other people won't be able to understand what is being spoken to them. And I know we've talked about this previously, but it's called the FAST acronym, FAST, that we've talked about before, which face, once again, arms, speech, and then time.
Very good. So for our patients with carotid artery disease, how do you diagnose it?
So like anything in medicine, we always do a history and physical examination. So in our history, if someone has a family history of carotid artery disease, then we can look into that a little farther. On a physical examination, we'll listen to the neck, and sometimes we can hear a disturbance in the blood flow, and that could be a sign, which would ultimately lead us to doing a more formal imaging. The mainstay or the gold standard for screening for carotid artery disease is what's called a carotid artery Doppler or image. That's where we take an ultrasound and we put it onto the neck and look at the artery itself and see if there's any narrowing, and then look at the blood flow to see if there's any increased velocity of blood flow.
Are there any other imaging or things that you can do to diagnose it?
Yes. So usually after we do a screen and we know that there is some disease process going on, then we can get CAT scans, CT angiograms, as well as MRIs to give us more of the anatomical or placement of the disease in the artery. This will help us later, mostly for myself, because when we do intervention, we want to know more information of where it is.
And for people that maybe do have some carotid artery disease, is there anything that they can do to reduce the risk factors?
Yes, exercise. If you're a smoker, stop smoking. Eating healthy. Once again, that's the high cholesterol. So if we can eat a healthy, balanced diet, we can decrease that. If you have diabetes, have that controlled either with medication or with diet. And I would say I'll backtrack a little bit. One of the biggest issues for carotid artery disease and preventing stroke is blood pressure. And the reason that is the higher your blood pressure going through a narrow area can knock things off, knock plaque off, knock clot off that can go to the brain or smaller vessels and clot them.
Very good. This has been really good information for our audience.
You're welcome. It was great.
And thank you for watching this episode of McLaren Port Huron Today's Health. If you would like more information or to schedule an appointment, go to our website at www.mclaren.org/PH vascular. If you would like to watch other videos, be sure to visit our video library at mclaren.org/PH video. Thank you for watching. This is Kelly DiNardo from McLaren Port Huron Today's Health.